Hello, my name is Anthony Bonetto and I'm a physician assistant with the Department of Neurosurgery at the Allegheny Health Network. Welcome to the online preoperative class for patients having minimally invasive spine surgery. In this video, we walk through the process of what you can expect to occur prior to your surgery, while in the hospital, and after returning home. You can refer to your patient education binder, which has detailed information about the topics we will cover. Also, your Diamond Care Navigator will contact you prior to your day of surgery. Your Diamond Care Navigator will provide guidance and support for you prior to your day of surgery, during your day of surgery, and follow up with you after your day of surgery. So, let's get started. Now we will discuss preparations for your surgery and setting appropriate expectations. An important piece of advice for our patients is that you need to have a positive attitude. The surgery alone is only half of the process. Returning back to normal daily activities is very important to us. This is something that you alone can do. We want you to experience the best possible outcome, which requires you to be an active participant. Once you work through this process, you should be quite pleased and happy with the overall results. Now, let's review a few things to prepare for your surgery. Be sure to complete your preoperative testing. You can complete your preoperative testing at one of our locations. Prior to surgery, you will want to maintain a healthy diet. Good nutrition is important to prepare your body for surgery and promote healing after the surgery. Eating a variety of foods rich in nutrients will help to protect against illness, reduce the risk of chronic diseases, maintain or reach a healthy weight, and decrease stress on your joints. Refer to your patient education binder for some guidelines on diet and nutrition. If you use tobacco, it is advised that you stop using it as soon as you can to improve your health and help in your overall recovery. A week or so prior to your surgery, you will also want to prepare your home for your arrival after the surgery. Our patients go home following surgery since it is best to recover in a comfortable, familiar environment. You will want to be walking around. If you have any throw rugs in your home, which could be a fall hazard, you will need to get them out of the way or make sure they are tacked down safely. Also, make sure that you have a clear path from your kitchen to your bedroom and bathroom. You should have a non-skid surface in your shower to avoid accidents. Clear hallways and stairways of any clutter and ensure they are well lit. Another step to consider is to organize your kitchen and other areas so that frequently used items are placed at waist level to avoid the need to reach or bend. It is also helpful to have a few meals prepared ahead of time because taking something out of the freezer and popping it in the microwave is much easier than standing at the stove to cook a meal. In order to decrease the risk of infection, everyone, including you, your visitors, and healthcare providers, should practice good hygiene at all times. Do not shave your surgical area 7 days prior to the surgical date. Starting 5 days prior and the morning of your surgery, bathe using the soap you have been provided. If this has not been provided to you, you can purchase it over the counter at a pharmacy. You should ask for Hibiclens. Instructions on how to use this soap are included in your patient binder. The day prior to your surgery, you will receive a phone call letting you know what time you should arrive, where to report within the hospital, and when your surgery is scheduled to begin. Following the fasting instructions provided to you. Generally, you should not drink or eat anything after midnight the night before your surgery. This includes water. On the morning of surgery, do not eat or drink anything. You may take any medications your doctor ordered with only a sip of water if you were instructed to do so. When your surgery day arrives, report to the hospital at the time you were given in the telephone instructions. Be sure to have your preoperative films with you. If you do not bring your films, your surgery will be canceled and rescheduled. Present your photo ID and insurance card at the registration area. You may make any copays or payments that may not have been made yet. You may be able to purchase any prescription needs, so bring your prescription card. You will then be taken to the pre-op area where you will be prepped for surgery. Your family will be asked to wait in the waiting room while you are getting changed, but then will be allowed to come back to sit with you before you are taken to the operating room. Your Diamond Care Navigator will be meeting you and your family in the pre-op or the waiting area. Your surgeon will come to see you and mark your lower back, confirming the surgical site. You may also sign a consent form at this point or review your consent previously signed for the procedure again. Make sure you understand everything on your consent form and have any final questions answered. A nurse will review your medical history and medications with you, as well as do an assessment and take your vital signs. Before your procedure, you will also meet with a member of your anesthesia team who will review your health history and any previous procedures. Please be sure to tell the anesthesia team member if you have ever had any reactions to anesthesia previously. They will then share with you what your anesthesia plan will be. You will also meet the circulator nurse who will review your consents and ask you a few questions for confirmation of the surgery site and procedure. You will receive an IV line to administer fluids and any medications ordered by your surgeon and anesthesiologist. When you are taken back to the operating room, your family will be asked to return to the waiting room. You may be awake or asleep when taken to the operating room. The OR may feel cool and the lights bright. Do not be alarmed when you notice some of the equipment. Once in the operating room, you will be connected to monitors that will help the team care for you during your procedure. Your procedure will last typically about an hour. If your procedure is taking longer than anticipated, your family will be updated. Once your surgery is complete, you will most likely be in recovery for at least 1 hour to upwards of 2 to 3 hours. Your surgeon will go out to the waiting area following the surgery to provide an update to your family on how the procedure went and when they can expect to see you. It is important to our team that your family or friends are aware of what to expect to alleviate any concerns they may have. At any time they wish to have an update of your status, please let your family or friends know that it is okay to ask a nurse. We will be happy to call the recovery room to provide an update. While in recovery, you will also be encouraged to take deep breaths and cough to help clear mucus and increase the amount of oxygen that gets deep into your lungs. This can help decrease the risk of developing pneumonia. You may also be given a tool called a spirometer, which will help with your breathing exercises as well. You may need to stay in the recovery longer than anticipated due to any reactions you may experience from the anesthesia or to help control your pain. Once you are stable, you are transported from the recovery room to an additional recovery area called secondary recovery. You may still feel groggy from the anesthesia. This will wear off with time. Also, continue to communicate to your nurse while in the postoperative care area and secondary care of your pain levels. Management of your pain is important and essential for your active participation in your therapy and recovery. Your physician will decide on the best method to control your pain. You will be asked often to rate your level of pain on a scale from 1 to 10. Every person has a different level of pain tolerance, so please communicate to your nurse how your pain medication is working. If you become nauseous at any point, please let the nurse know. There are medications we can give to you to help with the nausea. You may also experience constipation due to changes in activity, diet, and medications. Please make sure your care team is aware of this also. While you are recovering, a family member may go to the on-site pharmacy to pick up any prescriptions. Be sure to bring your pharmacy insurance card with you. Your family will be notified when you're in the secondary recovery area so they can meet you there. Once your healthcare team and doctor feel you are ready, you will be discharged from the hospital. Your healthcare team will make sure you're able to ambulate, have stable vital signs, and are able to urinate and have minimal pain and nausea. Your nurse will review specific instructions with you. You will then be preparing to leave the hospital. Your Diamond Care navigator and nurse will assist you in preparing to go home. Be sure someone is available to drive you home. You will have a small dressing over your incision. You can shower the following day after surgery. Do not scrub or use soap, but allow water to lightly run over the surgical site. Blood clots can be a serious complication, so several preventative measures will be taken before, during, and after your surgery. Compression devices will be placed on both of your lower extremities to help with circulation. After your surgery, you are encouraged to walk around. On the day of your surgery, you will likely not have much of an appetite. However, it is important to stay hydrated and drink enough fluids. Now let's touch briefly on what to expect for your recovery at home. This recovery period may take up to 4 to 6 weeks. This is a gradual process, and each day you will see more improvements even if they are small. Remain positive and have patience. Your Diamond Care navigator will be calling to check on you at home to ask about your recovery. There are several postoperative complications which you should be aware of. These are listed in your binder. However, I wanted to point out a few of them which should prompt you to call your surgeon's office. These include developing a fever greater than 100 degrees Fahrenheit, noticing increased redness or drainage from your incision, developing shortness of breath, developing pain in your calf which is not alleviated by your pain medication. A fever or increased redness or drainage from your incision could indicate a potential infection. Shortness of breath or calf pain could be a sign that you have a blood clot. This can be determined by a simple test which can be ordered by your physician, so please do not hesitate to contact the office. The majority of our patients have no significant complications following surgery, so we do not want you to be alarmed, but it is helpful for you to be aware. Remember, no prolonged sitting for greater than 30 minutes, walk around, no lifting anything over 5 pounds, no bending or twisting at the waist, no baths or submerging the surgical incision in water, no driving for 2 to 4 weeks or if on pain medications. Your care and recovery is very important to us. There is a lot of helpful information in your patient binder. Please be sure to read it and use it as a reference if you still have questions. You can also reach out to your surgeon's office and your Diamond Care navigator. Thank you for your time and attention today. Best of luck in your surgery and recovery.